Okay, so in today's clip, we'll be discussing the facial bones located on the anterior side of the skull. Okay. To start from the top or from the superior part, right here in between the eyebrows, right, you have the glabella. That's the structure belonging to the frontal bone. So if we are asking for the structure, it would be glabella. Bone, it would be frontal bone. Okay. Then we have the nasal bone. Okay, part of the nose, of course. Then we have the ethmoid bone, which is the separation between the left and right nostril, but a little more superior. The inferior separation right here is called the vomer bone. So that's vomer and the ethmoid bone. The ethmoid bone can also be viewed from the lateral side right here. Okay. So you can see this little duct, that's the nasolacrimal duct that drains your tears. So there's a line right above the nasolacrimal duct, and the bone posterior to it is the ethmoid bone. The bone anterior to it right here would be the lacrimal bone. Okay? Now back to the nose, we have the small ridges on either side of the nose. You can see two of them. These are the inferior nasal concha. And then we have the maxilla, which is pretty much making up your upper jaw. And then right here, you have the zygomatic bone, not to be confused with the zygomatic process, which is part of the temporal bone. Okay, so that's zygomatic process as a structure belonging to the temporal bone, but then right here we have the zygomatic bone itself. Okay, and then the lower jaw, this bone is known as the mandible, and the mandible itself has several different structures. Starting laterally, this process right here, or kind of protrusion, is called the condylar process. The anterior process is called the coronoid process, and then there's a notch in between the two processes called the mandibular notch, or notch of the mandible. This is the mandibular ramus, or ramus of mandible. Mandibular angle, right here. Okay. Mandibular angle or angle of mandible, and then this is the body of the mandible or mandibular body. Okay. So that's it for the facial bones.